We'll start now. Hello, everybody. Thank you for joining DataCon LA 2021. And welcome to this panel, which is titled Public Health Innovations in COVID Response. So you're in the right place. My name is Bob Neustadt, your host, and our co-host today is Priya Chauhan. We'll be monitoring the chat and QA if you have any questions for the panel in this session. And today the panel is moderated by Rebecca Friedman. So without further ado, I'll hand it over to the moderator, Rebecca Friedman, who's founder and president of Korey Strategies.
Great. Thank you, Bob. Thank you for joining us today on this session with DataCon LA, and thank you for DataCon LA for the opportunity. As Bob said, our session is titled Public Health Innovations for COVID-19 Response, and I'm Rebecca Friedman, president of Korey Strategies and a self-proclaimed GovGeek. So thank you for being with us here today. This session is being recorded, please note that, and this webinar will be a little over 1 hour. If you have questions for any of our panelists during that time, you can put them in the Q&A. We encourage questions and discussion, and we'll try to get to as many of those as possible during the session today. Please note also, we're all, of course, joining this session from our homes, and it is the weekend, so please welcome any pets and family or any Amazon deliveries that may inadvertently join the session. So we'll be patient with what we have at the moment. So I want to start by welcoming our attendees and thanking DataCon LA again. So in this session, we'll have we'll discuss two innovations that occurred at the Department of Public Health with LA County that they put into place to address COVID-19 response. Those are robotics process automation, or RPA, and the development of a community engagement data collection program known as Angelenos in Action. The Los Angeles County Department of Public Health's mission is to prevent disease and promote and protect the health and well-being of all Los Angeles County's more than 10 million residents. As you know, on March 4th, 2020, LA County officially declared a pandemic, and Supervisor Catherine Barger, who is then serving as the chair of the Board of Supervisors, stated that these declarations are a swift response to this emergent issue and will enhance our ability to effectively manage our response. On the same day, the Department of Public Health simultaneously issued a declaration of a local public health emergency, and the Director of Public Health, Dr. Barbara Ferrer, added, "We will continue to mobilize county resources, accelerate emergency planning, streamlining staffing, coordinate with agencies across the county and state and federal partners, and raise awareness about how everyone can be prepared for more cases and community spread." Now, nearly 1.5 years later, we know just what a critical role technology and process innovation played in that management and response they described. So today on the panel, we have panelists who span private and public sector who are driving the value of data quality, data integrity, and I'll start by introducing our panelists. I'm going to start with Praneet Raj. Praneet is he leads Accenture Southern California Public Sector Strategy and Consulting Practice in Public Health for the West. He has over 12 years of experience leading public sector assessment, strategy, innovation, and large-scale transformation of projects. And by way of an icebreaker, because I can't help myself when it comes to icebreakers, I'm going to ask Praneet what his first job was, because we all started somewhere.
My first job was making bagels and making pastas at a college, in a dorm. I was doing that, so that was my first job.
I love that. Basically, they put you on all the carbohydrates, right?
Yeah. Yeah.
Responsibility over all the carbs.
You needed that, right? You need it because you're short on cash. You're like, okay, that's everything right. At the end of the day, you take it home and give it to your roommates, right? So
there you go, condensed fuel. I love it. We also have with us today Chelsea Fu. Chelsea is an epidemiologist with LA County for the Acute Communicable Disease Control Program at LA County's Department of Public Health. Chelsea has a Bachelor of Science in Biology from UCLA and a Master's in Public Health and Epidemiology from the University of Michigan with a graduate certificate in Health Informatics. Throughout the pandemic, she has been an active member of the LA County's COVID-19 response. Thank you for your work, Chelsea. And her current work focuses on, you're going to have to help me with this, Chelsea. These are terms that I'm not even familiar with. analysis of novel approaches for the early detection of disease outbreak, but you're going to have to give us the exact terms on that. And please tell us, what was your first job, Chelsea?
Sure. So my first job was kind of an odd one. I actually worked for a transcription service. And yeah, so my current work is using novel approaches for different ways to leverage our data for the early detection of outbreaks, so that we can launch an earlier response, and the idea being that we can prevent further transmission.
Great, excellent, thank you. Welcome, and thanks for being here. Korey Edwards is another one of our speakers. Korey is a software engineer in Avanad's intelligence automation practice. He's a certified robotics process automation developer and has led several solution implementations to improve data integrity, reduce processing time, and alleviate workflow bottlenecks. Korey, what was your first job?
My first job was sweeping the floor for my mother, who was a hairstylist. And she paid me $8. I did it one time and I never did it again.
Okay, Korey, so what was your second job?
I have no idea. I don't remember after that.
We're not put to the task. That's fine. Newer motivation, at least, right? Motivation. And Spencer Steed is with us today. Spencer is an experienced leader with a successful track record building effective teams in a fast-paced SaaS environment. He cares about people and works to help them strive to improve process. So Spencer, why don't you tell us what your first job was?
So I actually received 2 offers for my first job. One was at Arby's and one was a company called Collision Zone Auto Repair. And I felt like collision repair would allow me to learn new things. And so I made that choice, and I ended up washing cars for about 2 years. So I didn't learn a lot, actually. I ended up just working my butt off, but it was a great start for me.
Yeah, something to be said for learning hard work, for sure. I think that is definitely a motivator as well. And in your bio, I did forget to mention, Spencer is the Vice President of Public Sector with Qualtrics. So welcome to all of our panelists. We're going to start by sort of setting the stage. We're going to do this session in 2 parts, as I mentioned. We're going to start by talking about the RPA solution at LA County's Public Health. And I'm going to start by handing it over to Praneet so he can give a little bit of background about what the situation was. We talked a little bit about the overall situation, and of course we all have lived the experience of going through COVID-19 and what that meant for our communities. But Praneet, if you could give us a little more information about that, and then we'll go into talking about the solution.
Sure. Thank you, Rebecca. And thank you, DataCon LA. Feels like I'm giving Oscar's speech, but yeah. This is my first time, being part of panel, so I'm really excited to be here. And yeah, it's just a weekend. I'm hoping folks who joined here, I know it's taking time away from the weekend, but thank you for joining us for the weekend, over the weekend. So as we all talked about, like COVID-19 impacts, right? So we all have been facing this since March of last year, and LA County was in the forefront of it, being the hardest hit in terms of all the COVID cases in California, large spikes in there. So in June 2020, Department of Public Health engaged Accenture to come in and help solve the problem with the data quality issues and the backlog, which is increasing for the contact tracing case interviews they were doing to stop the spread of COVID, right? So they were at peak, they were like around 5,000 interviews conducted a day, which had to be manually entered and then moved to a system called IRIS and DPH. And that system was critical to get all the data, so that for reporting and everything you use out of that system. So there were a lot of backlog going in because public health reallocated some workers from high value tasks for data entry, but you just can't keep up, right? So we worked with public health, and we use the technology called UiPath. It's a product RPA tool. We leverage UiPath to build this automation process, which will take the work away from manual workers, from worker doing manual data entry, and just automating the process so that those folks can do high value tasks, which they were really tasked for initially. So we deployed this automated process in 2 to 3 months. And then once it goes, we made it go live in production. We started chipping away through the backlog and handling the peak data volumes coming in as well. So it took us, I think the backlog was around 250,000 interviews, which were in the backlog because this keeps going up, and the team could not catch up. So it took us a few months to get down to zero, but we were able to get down zero. Everything is current. And the great value in what we did, and that we just took from one process to multiple process now. So public health is really taken to the next level. We're looking at how many processes we have now. I think 4 processes in production and more in the works right now. So with that, I'll pass on to Chelsea with our LA County Public Health to walk us through how this whole thing started, because she will be able to give more background about the what caused the problem to have. And once we're done with that, we'll then look at a demo as well. So Chelsea, could you please take it over?
Sure. Thank you, Praneet, for that overview. So I'll, as Praneet touched upon, I'll speak about this from the viewpoint of an epidemiologist and somebody who had never even heard of RPA prior to this endeavor. So let me go ahead and share my screen. So I'll start by briefly describing our data infrastructure and the challenges that led us to the automated solution. First, we have our core surveillance system that acts as a record of all of our COVID-19 cases. And so this is how we receive initial notification that a person has tested positive for COVID-19 in Los Angeles County. And as we collect more information about a case, the person's details are updated in this system. Our surveillance system is our data source for reporting to external partners, such as department leadership and the public. So it's crucial that we keep case records as complete as possible. Separately, we established a case interview system. We perform a detailed interview with every case that we are able to contact by the department. And during the interview, we elicit many crucial details about the case that are not always captured in laboratory reports and other sources that go into the core surveillance system. So given the separation between these two systems, there was a clear need to establish a process for incorporating the data from case interviews into our core surveillance system so that we had a unified data source for analysis and reporting. For many reasons, we could not mass import the interview data into the surveillance system using a tool like an API. For one, if there is data for a field in both the surveillance system and the case interview system, there are many complex considerations that go into which is considered the source of truth. Given that limitation, initially, the main tool at our disposal was manual data entry. We had to, as Praneet mentioned, we had to reassign DPH staff from other valuable tasks to work on manual data entry. So case counts and the number of interviews completed daily grew exponentially, as did our data entry needs and our data entry team. Eventually, we had 15 full-time data entry staff. And despite their best efforts, the staff could not keep up with this volume. Even if we had unlimited data entry staff, we had significant concerns about this approach. But staff was not unlimited. It took an average of 10 minutes to enter each interview, and we had up to 2,000 interviews completed per day at the time of implementation. We quickly accumulated thousands of cases in the backlog to be entered. So secondly, our surveillance system is very nuanced. Orienting staff required significant training time. There are also concerns around security and data integrity when granting access to too many users. Next, as with any manual data entry, the process is prone to data entry errors, as we're only human. Finally, we worried about variation between the many data entry staff and how they may choose to reconcile differences between the data sources. There's a need to be consistent in our decision-making, as it has the potential to impact downstream reporting. So fast forwarding a bit, we implemented the automated process that Korey is going to go into more detail about to address these many issues that I've gone over. And it's been a very successful endeavor. We no longer have dedicated entry staff for this process. those 15 staff have been able to return to their regular job responsibilities and perform other important work for the county. Instead, we have 2 staff who review the results part-time, and on average, the RPA, the automated solution, has a 92% success rate. It's a very small portion of cases that need to be manually reviewed and entered at this point. By implementing the automated solution, we eliminated our data entry backlog. At the beginning of this process, we had over 120,000 interviews in our backlog, and interviews are typically entered into the data. Interviews are typically entered into the surveillance system within 24 hours. To date, we've processed over 500,000 transactions. And of course, all of this means that we've greatly improved our data quality. The automated solution has enabled us to enter interview data in a systematic and timely way. And so the result is more complete information on case demographics and other crucial information on which we rely for our county's response. Ultimately, we are better equipped to inform our public health leadership, our county leadership, and the public as trends emerge. And with that, I'll hand it over to Korey to speak about the automated solution.
Thanks, Chelsea. So yes, I will share my screen as well, and I'll have a video that essentially shows our automation running against the system that Chelsea was just describing. So just give me 1 second. And I'll essentially narrate what is happening in the video, and also give details about the logic that's occurring, how we kept our data in integrity, and various ways we were doing quality assurance and things like that. So I'll start the video and narrate like I mentioned. So this is the case interview data entry process. And on the left side, we essentially would get an Excel sheet with data that we needed to update inside of the system on the right. And it will include like their race, gender, sexual orientation, symptoms, all sorts of things that are valuable to, as Chelsea was saying, determine various things about the COVID and can predict outbreaks and things like that. So essentially what the bot does is it reads the information off of the screen on the right, and it would go through 3 or 4 tabs to find that data and compare it to what's inside of the Excel sheet, which is our source of truth for the data, and then update it accordingly. So in a few moments, I will start the automation, like again with Praneet mentioned, this is using UiPath. And for this, the bots usually run every 30 minutes to check for a new file. And then they create work items to actually do that work. And it's a per record case. So in this video, I'm just starting it manually since it's a demonstration. And then I will remote into the bots itself, so or the automation itself. And essentially all of these run on their own machines as if they're a digital worker, as a person would log into systems and interact with the data itself. So here you can see that the system is logged in, and in the video I'm not touching anything. And then it's going to look up that case that we just saw and then start performing its data entry. So like I mentioned, it's going to go through this first tab, read everything on there, the patient's name, and start comparing it to what's in the Excel sheet. And it's going to move on to a second tab called the PUI tab, get some more information on there. And if you notice, there's also the race is other or unknown on here. Those are going to be updated later. And then the PUI information is also blank in this situation. And then it's going to move to the investigation tab as well. And the reason I mentioned the race and ethnicity is because that's actually one of the most complex logics that we have to deal with inside of the system. And actually, I'm going to pause just briefly. So in the system, we had to read that information, and if it was a value specified within the Excel sheet, we had to determine if it was actually selected inside of the system or not. And if it was selected as other or unknown in the system, then we need to uncheck those 2 values and then add the correct one. So we had to keep doing this logic against what is the right information that has to be put in and how do we handle it. So we could handle pretty complex business logic so that we could get the correct data in there. And one of the things that we were doing as well was keeping track of everything that the automation was doing. So what you just saw, I'll just back up. a little bit here, was the automation going into the system and uploading two files. One of them was a patient form, which was a PDF, and the other one was an Excel sheet, which actually lists all of the fields that the automation is interacting with, and what the logic was to update that information. So if there was a change needed, we always had a record of what the automation was doing, so that we could come back and say, is this correct? Or if something went wrong, we can see why was it, do we have this business logic, or do we need to change anything? So I'll keep going from here. So essentially it goes and looks up all the necessary files and attaches them into this application. And then once this closes out, it's going to actually go and update that information. So it moves back to this patient tab, and you'll see it start to fill in information and uncheck this other and unknown value as well. So as you can see, it updated the race here, and it selected the ethnicity and unchecked those two. Again, one of the logics we needed to implement to make sure that we have the most up-to-date data. And then I'll keep going here. And it's also updating the sexual orientation and gender, but it's collapsed at the moment. So then it'll move on to the PUI tab, and it'll fill in some drop downs and things there. And one of the things that, as Chelsea mentioned, like humans are prone to error. So there could be typos, they could be selecting the wrong thing in the drop down. Having these repetitive rules and consistent rules removed all of that wiggle room for error, quite frankly. So that's one of the key things that came out of this as well. We were able to do it quickly, and we were able to do it consistently with the same rules. There was no question between what the bot should be doing. So then it's going to finish up and save all of the information, and then essentially go through and confirm all of that data was updated correctly. It pretty much, that is the end of the demonstration. So one of the issues that we actually ended up finding with this automation was in our test environment, where data was not being correctly pushed from the back end to the front end environment. So we saw that when we were going through and the automation was updating some from these details, that it had persisted this blank data back down to the database. And after some investigation and using that logging that I mentioned, that Excel sheet, we were able to figure out, okay, something's actually going wrong in the system itself. It's not correctly pushing the data, it's being lost somewhere. So that was one of the other key things about this automation, was that we could actually, even though that wasn't the actual full purpose of this, we could actually troubleshoot and find issues within the application itself. So it's actually ended up being a very, very useful tool, both from the case data entry process and also from checking the data integrity. And that's all I have. I'll pass it off back to Rebecca. Thank you, everyone.
Okay, thank you, Korey. So I don't see any questions yet in the Q&A, so I have a few questions myself for the group. I'm interested to know, I think the basic question that we always look back, starting question, is lessons learned from this project. So as you were kind of evolving this over time, and I know it wasn't a long period of time because this did roll up very quickly, but what lessons learned did you have sort of initially and then now looking back? I guess I might start with Chelsea on that one, since you're actively in the department.
Sure. So I think the big lesson learned for me was really not a technical one. It was about the initial testing and validation of the process. I think on both sides, it was less straightforward than we anticipated, and there was a lot of back and forth, and there was this need to consider every possible combination of values for, I think, 20 to 30 fields that we're updating. So really taking the time to think through that and being willing to go through this iterative process of testing and validation and troubleshooting and starting all over again. And I'm really thankful to Accenture for being really great partners and working through that. And I think that's why the end product has been so successful.
I'm going to ask a similar question to Korey, because you work almost exclusively on RPA projects similar to this. However, not usually with the constraint of, I would just, obviously there are time constraints, but not usually with this sort of national crisis, if not worldwide crisis, and the time pressures of that. So were there any particular lessons learned around a project that happens out of sort of public health crisis or otherwise that stick with you?
I'm not sure if there's any particular in that sense. It is definitely a different sort of gravity to the situation, right? Because you want to make sure that everything is being done correctly. So similar to what Chelsea is saying, like taking the time, even though we're under a time crunch, but making sure that everything is working as expected, because at the end of the day, it's also a person's information, and making sure that we have the correct data that's in there, and making sure we're not, exposing anything within the system itself. So sitting down and actually thinking through all of the logic, I think, I guess that could be a lesson learned, like being very particular about going through every situation and saying, well, is this the way that it has to be done? Is this the way that we've been doing it? Or how can we make this process better? And coming through every situation. What I've seen in a lot of these solutions in RPA is that we get used to doing these tasks, right? We've always done them, and we kind of just go on autopilot and also be prone to errors. And so we forget how many steps are actually involved in a process that we think is really simple. And then when you actually start listening out, it's like, oh, we have this exception, we have that exception, we have to think about this and all that. So really taking the time to just map all of that out is huge.
Yeah, absolutely. We did receive a few questions in the chat. So the first one is it possible for you to directly enter the data electronically at the first time so that the step of data reentry can be totally eliminated? I'm not sure.
I think that's coming from like the interview process, I believe, Chelsea, from like the putting it from one system to the other.
If I understand the question correctly, the reason that we can't accomplish that is we're using two separate systems. The interview system, where the data that needs to be where the data is collected is separate from our surveillance system. And the surveillance system is what we're reporting our summary statistics off of. And so really the automated process is what's providing the link between those two separate environments.
Yeah, let me add one more thing here, right? I think the thing was, the reason for two systems is because of contact tracing, we never did that in the past, right? It's a whole new concept which impacted every resident of the county. So because we had to quickly, LA County Public Health had to quickly stand up a new system, and the surveillance system was different. So there were two different users. So that because of that, two different systems was created. And now when you have two different systems, how do you get the data in? And because of the time API, like Chelsea was talking, it was faster to get data in, and that's why the automated process came in and helped save the day. Right. So I think that was the reason why there were two systems. But in the ideal world, it could be done in one system. Yes, possibly, but it's going to take a lot of effort to do that.
Yeah, thank you, Praneet. That makes a lot of sense. And to develop a contact tracing module within our system, that can easily take months, if not years, of development, which was just not an option for us.
Yeah, and the second question that came in is similar. Was there a manual interview that populated the spreadsheets initially, or is it all self-reporting by citizens in the portal? What I'm understanding is that it's a manual interview that was taking place. Is that right?
Right. So it's not self-report through a portal. We have an entire interview branch that they're the only ones interacting with the interview system. They are contacting or going. Now they actually even go out into the field to interview cases, and they are the ones that manage that data and enter it into the system.
And I think it's important to remember that when Praneet talks about, yes, this in an ideal world, of course, this could be a system that sort of interacts with one another. But the current system and as Chelsea said, it can take quite a while to develop a system like this, because it's not just used for one disease, one communicable disease. This is used for all outbreaks, all communicable diseases across LA County. It's, diverse geography, it's a diverse population, 10 million residents. So the size, the scale, the geography, and all of the other challenges that are generally taken into account, as well as the volume of diseases that are used in the system. So all of the different factors, like Korey was mentioning, all of the sort of nuances in the questions are not necessarily initially thought of, and that would have to be considered for the broad scope of everything in the reporting system.
Right. I would like to add one thing about the spreadsheet part, right? The spreadsheet part came because we figured out after a lot of trial and error, because when we started new, right? We're in time crunch, we had to say how to make it work. We figured out that the best way for the automated process to read data consistently and get a lot of data inputs was a spreadsheet, and we can define the formats. But though that spreadsheet was not populated manually, that was the output, and we've transferred into that. It's not like someone took there and typed it in the spreadsheet. So it was automated process there as well. But the input, one of the big lessons learned, I think you asked this question and I couldn't get a chance to jump in, but the biggest lessons learned in this whole endeavor was the input, right? Input is crucial. If you have an evolving input format or involving data fields, which keeps on changing, the output will be, you have to continuously keep updating. It doesn't mean that you can't update it, but with COVID, what was happening, every time CDC changes something, because evolving situation, things had to change and adapt faster. So it was easier for us to go into an Excel to take that as a source point, so that automation process can really doesn't have to impact a lot versus redoing everything. So that's some of the things lesson we did in coming up with a spreadsheet process.
Yeah, and one final quick question. Are there other applications, possible future implementations of this across the department with other communicable diseases or other kind of iterations of this being considered as we are hopefully coming to at least the downturn of COVID-19? Well, I'll kick that one to Chelsea again.
Sure. So not only considered, we have other processes now in place. The interview process was our first endeavor with RPA, and it's been our most successful and highest volume process. But we have, off the top of my head, I can think of 3 other data sources that are using this solution as well. And I think this has been really a successful proof of concept, and something that we would certainly consider for other diseases as needs arise in the future.
Excellent. And then one final question came in. We'll answer that one really quickly. Korey, this one is for you. It says, Korey mentioned that the back end and front end, is the back end a legacy mainframe with a web layer on top?
So to be honest, I'm not entirely sure. So it is the application that we're entering data is a vendor application. So I don't have too much insight on its entire infrastructure, but it is a web application that we would insert data into. But to that point, I'm not sure if there was a discrete backend connection that could have been also one of the reasons why they had trouble trying to build a solution to get information into there. It may have been, like Chelsea was saying, a whole other endeavor to open up that backend process.
Okay. And if anyone is wanting to follow up with any of our speakers or reach out to me, and I can direct you to any of our speakers, I believe our contact information is within our profiles, at least through LinkedIn. You can connect with us and send us any further questions about the application. So thank you, Korey, and Chelsea, and Praneet. We're going to now move on to Spencer with Qualtrics. We're going to be talking about I had introduced this as a community engagement data collection program called Angelenos in Action. And this is something that allowed the county to have an understanding of citizen experience and a holistic view of what was happening, the experience that individuals around the county were having. So I'll let Spencer, who's the Vice President with Public Sector with Qualtrics, speak a little bit more about that and explain what that actually means and what the program was. Oh, you're on mute.
Thanks, Rebecca. Sorry, I have kids running around my house, but I'm trying to stay calm as they keep doing what I've told them not to do 3 or 4 times.
Cameo appearances welcome. It's all,
Yeah,
it's all
100%.
good
So,
these days.
yeah, I think just before I start, one call out from the work that the team has done. I know one of the major elements of success in regards to case investigation and contact tracing is speed. And so the element that they added of automation here, just drives tremendous impact, right? If we're able to get a hold of people quicker, find out who they've been in contact with quicker, we reduce transmission. And so it just, great work, team. I think that's really awesome what you guys were able to solve for, recognizing, the separate systems and how difficult those challenges are. So yeah, Angeles in action, really, this is a story that LA County has been given a lot of credit for across the country, because if you remember, when COVID first came out, there was a lot of things we didn't know. We just had a lot of questions, arguing where the disease came from, what were the symptoms. Some people were having their feet turn blue, and was that a new symptom? And there was just a lot of fear and uncertainty, and we didn't really have the testing capacity early on that we needed to effectively even contact trace or case investigate. So, Los Angeles County Health Department really came up with an awesome solution. And I think it's important to know that we didn't deliver any services, right? This was low code, no code, Los Angeles County's Health Department standing up a solution on their own, without any kind of support from us besides a technical infrastructure to support the execution. And so it really was around employee community engagement, trying to answer some of the questions early on that we didn't know, but then it simplified into trying to develop a panel. So I'll pull up, is it best for me to share it, Rebecca, or do you want to share it?
Yeah, if you're able to, I have it up otherwise, but if you are able to easily share, let's go that route so you can click through.
So I'm getting a blocker on it. Will you just pull it up, Rebecca,
Sure,
and then
no
go
problem.
to slide 3?
All right. So I think you should be able to see it now.
Perfect. And then go down to slide 3, since I don't need an introduction.
There.
Perfect. All right. So a little bit, again, as I had mentioned, there were a lot of things that we didn't know prior to mass testing. It was hard to get a response from our residents in general. We were struggling to connect with residents in general. So the ability to connect to residents was really important to try and understand how COVID was affecting them, if they were feeling symptoms, so that we could potentially use this data mixed with some of the structured data that was already in the systems to try and identify, as Chelsea had mentioned earlier, where some problem areas might exist, help inform the decisions that were being made by the Department of Health, so that we could support potential outbreaks, or even in some of our other customers across the country, like Houston, do people have access to healthcare, to a ride, if they need hospital assistance? So there's a lot of availability there. We stood up a really simple 1-question survey that was just asking people how they were feeling. It took them less than 1 minute. After standing this up, we had, I think in the first week, up to 10,000 participants in the panel with an 80% response rate. That quickly grew to 17,500 participants in the panel, and maintained the effective rate of 80%, which was really important when you consider that we were getting data faster, and that this started to be a representative sample of what our community was experiencing, and where there was potential issues, whether that was in specific zip codes, demographics, or area of struggle. Okay, next slide. So this is just a little bit of an overview of what the solution was. The first piece is that we needed to meet people where they were. So we deployed this omni-channel, whether that's through text message, through social media, through email. We wanted to make it easier for people to participate. Once people participate, we actually embed them into a panel, or what we call XID. That panel can be both anonymous or confidential. But it's really important because it allows us to start to see some of those other indicators like zip code, demographics, symptoms that can start to roll into one overall profile. We asked a really simple question about how are you feeling, and then we could drive them into different workflows based on those responses, and again start to get some preemptive data prior to testing being readily available of where we potentially have some hotspots that take place. Next slide. So one of the elements that we quickly identified in the pandemic, I think not only in Los Angeles County, but in major urban populations across the country, is we actually got a really high response rate in two-way text messaging. Rather than having to have internet access, or maybe people are still using flip phones, our initial assumption is that we wouldn't get a high response rate, but through a two-way text conversation as our deliverable, we saw really high response rates across the country, and including LA County, which gives us a better representative of some of our underserved populations that don't often have a voice. So not only is accessibility really important that LA County was able to solve for, but we were able to do it in English and Spanish. And I know they're having a number of discussions right now about other languages, Korean, to use this potentially for other communicable diseases. But meeting people where they are in an accessible environment in people's first language is a really key element to trying to get people to participate in this panel, which can give us some data that makes us more predictive when you combine that with the results that we have inside of the core infrastructure system that exists. So again, meeting people where they are through accessibility and through multiple languages or localization has been really important in Los Angeles's ability to connect with residents. Next slide. This just shows you an example. Again, for Los Angeles, for Angeles in Action, it was a confidential panel. So we actually didn't record names. We kept it anonymous, but there were really important data factors that we were gathering that helped us kind of identify where potential risks or problem was, whether that's IP, geolocation or geo tracking, and then as well as the different symptoms that are coming from specific areas that we could then consolidate into one large panel, and then we can drive this data through simple API calls to the system infrastructure that's already in place. Next slide. So I talked about this at the beginning, but I think this was kind of one of the wake-up calls of the pandemic, is we just weren't in a position across the country to be able to, from an infrastructure standpoint, to be able to respond to the needs of our citizens fast enough, both from a workforce perspective, but also because we had a lot of legacy systems that just didn't have funding historically to update or replace. And so we were now in the spot where we were trying to connect. And I think the thing that Los Angeles deserves so much credit for is their ability to take this system without any support from even us and be able to stand this up on their own. And they stood this solution up in less than a week. And they were getting a panel that they still have today, which is currently running, which can now be pivoted and used in many ways, right? Whether that's a new variant, whether that gets transitioned into other challenges that public health is dealing with. Typically, old research would require purchasing a panel, working with an organization to help kind of stand up a technical solution, working with their internal stakeholders to write a questionnaire or survey. But in this case, they now have a robust panel. They have the expertise and the ability to stand up this solution. And because it's low code, no code, they can then drive this data set into the infrastructure, whether that's Salesforce, ServiceNow, Microsoft, Slack, Zendesk, with if-then statements. And so their ability to respond, to have agility, and to meet the needs that we don't know are going to come yet was I think strengthened over the pandemic, and we just their results were pretty phenomenal. So again, they stood up on their own, and we just think that's an impressive feat considering that they were trying to keep their heads above water and support a raging disease. So a little bit about community engagement overall. A lot of times we're in a position where we have a lot of structured data, right? And it can be difficult to truly understand. We know what's going on, but it can be difficult to understand why it's happening. And so, we believe at Qualtrics that understanding the why or the experience data by looking outside in can help us be more predictive and descriptive of what's actually going on. And if we can be predictive and prescriptive of what's going on, then we can make better investments, better choices. We can reduce cost to serve, and then we can operationalize our human capital into the program outcome that was intended for. Right? Public health was here to drive the results, reduce transmission, and as mentioned before, in a lot of scenarios, they were putting in positions where they had to do data entry to survive. And our goal is to help use technology to help public health, help governments put more of that human capital into the intended outcome of the program. So that's a little bit about Angelus in action. Last slide, if you want to go to the skip one, go to this last one. This panel is still going on, and Los Angeles would like to continue to invite everybody to participate. If you're over the age of 18, you can text @protect to that phone number and join in the panel. This panel will become very helpful for them to continue to use data to be predictive and get ahead of some of the challenges that they face. So with that, that's kind of the overall presentation of what it looks like. I'm happy to take questions if there are any.
Great. Thank you. So one question did come in. Thank you, Spencer, for the overview of the program. The question is, how big is the panel now? Is the county thinking of leveraging this panel for other diseases and other topics? And what is the demographic mix of the panel, e.g., gender, race, and age?
Yeah, so I can't speak for the county. They're not able to participate with us today. So the panel got up to 17,500. I think it's down now roughly, I think between 10 and 12,000. They do want to still market it. There is considerations of using it for other communicable diseases and other challenges they face. And I don't have the demographic answer. I apologize.
Okay. And you spoke to some of the lessons learned. Did you want to kind of highlight some of those? Again, I recognize that the county isn't here to speak on their behalf around lessons learned, but it does sound like you were able to roll up a program that, presuming that you have similar programs for other uses around other jurisdictions in the country. But how were you able to do this so quickly? What was the sort of the magic to making that happen?
Yeah, so I think, Qualtrics got its foundation working with higher education, right? So we've been doing high stakes research for 20 years. And so because we're purpose built for specific research, it's a pretty simple infrastructure that has a really kind of specific outcome what people are looking for. And so, credit again to the county, but the technology is purpose built for exactly what they were using it for. And so it didn't require a lot of expertise to be able to stand this up. In regards to the response rate, that's a really high response rate. If anybody's done research before, 80% is world-class in a large county. And, I'd love to say that it's all because of accessibility and language. I think there was probably something to be said about the panel and who was participating in the panel, and then the time, right? There was a lot of fear. There was a lot of concern, anxiety about what this was going to mean. And so I think people were probably leaning in extensively to do everything they can to potentially help give the county the data they needed. So does that answer your question, Rebecca?
Yeah, and I want to go back to the earlier questions around demographics. I know we don't have the demographics ourselves to present on this, but that information is collected, right? So yeah. The county does have, as we saw in the resident panel, the overview, age, gender, ethnicity, as well as the specific region within LA County, because we understand that we want to be representative across all of the districts of the county, all the geography of the county. That's always been an important thing for really any department, but particularly in a public health crisis, to understand that the information we're getting back is representative.
Yeah, and
demographics.
absolutely, and they own the data. LA County owns the data, so we don't have access to the data. That's why I can't share those results with you, and it is confidential. So, it's something they continue to use and can use. We have seen though that this one of the reasons why we get a high response rate is because we're battle tested, right? Like we've been trying to get people to respond to surveys forever. That is why that industry has been disrupted. So similarly in Arizona, we got a really high response rate during the pandemic. And we do have data that's validated. We actually got underrepresented voice. So we're able to hear from people that typically aren't responding. And I know there was a lot of concern that they needed to talk to somebody or they needed to have kind of a manual presence, but we actually saw some people were more comfortable in a digital environment. And that was another reason why you can get underrepresented voice, is you can give people different opportunities to engage than what might be considered standard.
Okay. Another question that came in is it difficult to add and change languages within the forms? And did the county outsource this?
So we have Google Translate is embedded in the platform, which if you've used before, it's not going to be 100% correct. But it has an editing profile inside of the platform as well. So if you have native speakers, they can review the Google Translate, which is just a click of a button. They can make the edits, and then it'll automatically translate back into English. And then we also provide those services if necessary to have native speakers review.
Okay. And I know just in general, the county obviously engages translators as well as interpreters, and has those on staff and on contract that they use regularly throughout COVID-19 health briefings, the daily briefings, and ongoing with multiple languages. So certainly an emphasis for the county in terms of inclusion.
Yeah. I think sometimes what happens is you'll go in like a typical research project like this, you have an English version, a Spanish version, a Korean version, and then you'd have the translation to go create that program. You'd send it out, you'd collect the data, and there'd be a translation back. With Qualtrics, you have the English version. You're able to create multiple different versions within that same version. It creates a drop down, and then it automatically translates all back into English for your data.
Gotcha. Okay. And in sort of setting up a program like this, because I think that that's an important thing to think about, all of the innovations that have come through COVID-19. Obviously, there are applications, as you said, with future variants, but other communicable diseases, as well as other applications across other departments, whether it be health-focused departments or otherwise. So what are some of the first steps or questions someone should ask before kind of collecting this type of data, interpreting the data, or setting up a program like this? So it's kind of a broad question, but what's the kind of initial questions that someone should ask themselves in a department if a program like this is a good fit?
Yeah, I mean, I think generally a program like this is to try and give us answers to things that we don't know, right? And so, I would start with the question, like, what are we trying to accomplish and what are we trying to understand? In regards to standing this up, there are a lot of ways to stand it up. There's a lot of internal capacity in government around research. There's a lot of partner systems. People like Accenture and Deloitte have the infrastructure to support these types of programs as well. But technically, it's really simple to build a program like this. That's this simple, and I think from a technical standpoint, I guess I don't really have a good answer, but it's a pretty low lift to be able to do that. I think a question that might maybe add on to that is sometimes we don't engage in these programs because we don't know what we don't know. Right. And we identified that during the pandemic, for example, with vaccine hesitancy. And we identified quickly in the state of Utah that there was vaccine convenience problems, right? In some of our Latino or Hispanic communities that were working later hours, it wasn't convenient for them, and there wasn't a facility that was open late enough to meet the needs. And that supports hesitancy. And so, that wasn't something that we were looking for or asking for, but by constantly listening to our residents and citizens and designing our systems outside in, we get some really good insights. Rather than being just data rich, we can be insight rich too, by asking the right questions across the programs that are being delivered.
Great. All right. And seeing no further questions coming in from our attendees, any final thoughts on the program or anything you would want to share or let people know?
Nope, thank you for the time.
Okay, all right. And then that also goes back, I don't know if this conversation sort of sparked more from Korey, Praneet, or Chelsea. I want to give you the opportunity to add any thoughts you might have, any final thoughts before we start to wrap up. Hearing none. Okay. All right. And always, and of course, during these unprecedented times, we appreciate public health's willingness to continue to embrace innovation and to address the needs of residents. This is absolutely critical, and they've done an incredible job in pivoting quickly and responding quickly and keeping people informed. And I think that that's part of what we were trying to share today, the outreach and the ability to address concerns with volume of data coming in. These are all in response to the needs of residents and being able to serve the residents better. So I want to thank our session attendees for their time. This is the weekend, of course, and we know that other people will be joining and watching this through the DataCon LA YouTube channel, and we welcome any feedback. Again, our contact information is available in LinkedIn profiles, so if you have any questions about either of these programs, please reach out to us at any point. We hope you enjoy the rest of the event, and I want to thank Praneet, Chelsea, Korey, and Spencer for being here with us today, and of course for LA County Public Health for letting us share these stories. Again, our goal was for you to be able to leave this session with an understanding of the importance, particularly of data quality, and to support the public sector and civic engagement, and have some idea of resources or how you could take action in your own organizations. So I hope we have achieved that goal, and I want to thank DataCon LA and of course the event sponsors, and I'll hand it over to Bob to wrap up if we have any other instructions.
Okay, well, you summarized it very well. Thank you, Rebecca. Thanks, rest of the panelists. We really appreciate your time here and sharing your insights and perspectives. I think both the case studies that you highlighted the value of data in supporting valuable workflows during a public health crisis. So it was very interesting, and thanks for the peek behind the scenes. For the audience, the live audience, please provide your feedback in the form provided in the chat box. And thanks to everyone for attending our panel today. Have a wonderful day, and thank you for being part of this year's DataCon LA. Bye-bye.
Thank you.
Thank you.
Thank you, everyone.